Waterborne diseases, I told you, the common waterborne diseases which we see are enteric fever, or medically we call it typhoid fever. You have a cholera, you have hepatitis A, you have simple gastroenteritis, and leptospirosis. Out of this, except leptospirosis, all are through ingestion of bad or contaminated water, or uncooked or raw food, or untreated food, or spoiled food. So you talk of hepatitis A, you talk of gastroenteritis. If you are eating some street roadside food which are not cooked properly, or raw food, or food which has been kept, or stale food, then the chance that you may develop these infections. Similar also with water. If the water which you're drinking is not safe, then you may develop gastroenteritis and even hepatitis A, which may lead to jaundice. Even typhoid also mostly through waterborne. The leptospira is a little different from this. Leptospirosis is not so common in the urban context, but now that urban and rural, semi-urban, all getting mixed up as the cities are expanding more and more. So we are encroaching into the semi-urban and suburban and the rural areas. So leptospirosis, we do seeing more in cases now. Basically, it's through rat's urine. I mean, the rat's urine contains the leptospirose organisms, and if the water is contaminated, like especially people who are mostly agriculturists, or the farmers, or working in the fields, if they're walking with barefoot and there is a cut in the foot, they have some cuts in the foot, they're walking with barefoot, and the water there is contaminated with the leptospira organisms secreted from the rats. This organism then will enter through this contaminated from the cut wound, through the contaminated water, and then cause bloodstream infection. This is a different way. The others are all through ingestion of bad water of food.